Welcome. My name is Natalie Barkley. I'm one of the educators here at Catawba Valley Medical Center, and I'm going to be taking you on a virtual birthing center tour this afternoon. Before we get started, I just want to tell you about some additional resources that we have here at the Pavilion, one of which is our car seat safety checks. Ella Thompson, our child safety seat technician, is here at the pod, and she would be happy to come out and check your car seat to make sure it is installed properly, and she does that by appointment. If you would give her a call, she would be happy to help you with that. I also want to let you know of our iBirth app. On the app, you'll find a lot of helpful information and resources, so please utilize that. It will also give you helpful links to our website with our events and our classes. I'm going to go ahead and take you on our tour. We're going to start here in the lobby. This is where the entrance is to the pavilion. When you are coming to the hospital in labor, you are going to use the parking lot out here. You will come into the entrance and then head on up on the elevators, which are to my left. At 9 o'clock, we do lock the inner doors. There is a telephone in this outer entryway there that you would simply pick up the phone, tell us why you're coming in, and we'd be happy to open the doors for you. It's just an extra added security measure here at the hospital. I'm going to go ahead and take you up to LL, which is the lower level, to show you the waiting room. Follow me. And here we are on LL, which stands for lower level. This is where our waiting space is. We have one here. We also have a small waiting space over to my left. It's very comfortable. We encourage family, friends to come down, rest. You may eat in this area. There's also Wi-Fi available. There's TVs as well. And this is a wonderful area for any of your support people to come down and again, take a rest. We also have usually an attendant here at the desk who'd be happy to answer questions and to help anyone find their way to another part of the hospital. We do have a cafeteria here, and she may help you sort of navigate your way over that direction. We're going to go ahead and head up to the second floor. So here we are on the second floor, and this is where you would check in with one of our attendants here when you come in labor, and they will have your nurse to greet you here and take you to your labor room. I'm going to go ahead and take you guys back to the room that we're going to see this afternoon, so if you would just follow me. All right, guys, come on in here with me. And here we are into one of our very nice birthing rooms. I think that you'll really love looking around the room with me. So let's go ahead and get started and talk about what we offer in all of our labor rooms. Just to let you know, we do have 18 labor rooms, and all of them are identical to this setup. I'm just gonna move about the room and show you what's available and talk with you about that. So come with me. Of course, this is our bathroom, and we do offer a great size. I like to show everyone, and I'm pretty proud of this nice bathroom, this large soaking tub. We use that for labor comfort. And so water therapy really helps moms cope with their pain in labor. I think that you'll find also that the bathroom is clean and it's very nicely done. There's also your typical sink and toilet here. Your nurse will also probably point out we do have some emergency areas, so if you felt like you were going to faint, for instance, you would pull one of these cords, and it is for emergency help. I always like to point that out, okay? Come on out this way. We'll start going through the room. All right, in every room, we have a rocker glider. It's very lightweight. We can move this out a little bit, but this is one of the best places to put it while we're storing it here. This is a great space-saving couch. I'm going to go through what is offered here. We have seating on either side, and this is actually a table, and it will lock in place and then lower when we need it to be flat for the bed. There's a gray button on here. We're gonna press that, and it will release our cushion. And this will be a bed for a support person. We'll also provide sheets, blanket, and I tell everybody to bring their own pillows. Makes it more comfortable. It could certainly supply a pillow for you as well. And then when we're done, we're just going to lift, and it will go back into place pretty easily. Okay. Let me go ahead and go over the labor bed. We have typical hospital bed amenities where you can call your nurse, control lighting, TV. Labor beds are also set up to where we can remove this lower piece. We can expose foot pedal and stirrups on either side of the bed here. We also offer labor balls for labor comfort, squatting bars, and then some of our moms are ambulating in the hallways. We encourage movement through labor, and these things will really help facilitate a good, effective labor. We also offer some pain medication options. We offer epidurals, nitrous oxide, and IV pain medicine. Let me just move right over this way. And this is the monitoring equipment for moms while they're in labor. We have this computer system is centralized monitoring, meaning that the nurse can see what's going on in her room, maybe at the nurse's station. She's probably going to have another patient that she's helping during labor, and this will help her make sure everything is going well in all of the labor rooms that she's taking care of. Your contractions would be on the bottom of the screen if we were hooked up, and then the baby's heart rate would be on the top of the screen. We have external monitors that we will hook up, and that will then plug into our system and then put that information up on the screen. It's a great way to see how baby's doing during labor. We do offer intermittent monitoring during labor, meaning that you come on and off the monitor so that you're able to be more mobile during your labor. We have a thermostat in every room. Moms usually like it a little cooler, and I understand that. So we can adjust that temperature. And we also have some emesis bags here in case mom's not feeling well. I always like to point this out for support people. You're also welcome to grab a bag for mom if she's not feeling well. The warmer is tucked away here. And as I get this out, I want to go over, make sure that you understand the progression of the events that happen right at the end of the labor process. When babies are born vaginally, they are placed on mom's chest, skin to skin. We really feel like that's important to go ahead and start. It's helpful for bonding. And then we will also progress into feeding. So either breastfeeding or bottle feeding. is done after the repairs are made to the perineum. And then after feeding, baby is moved under here in the warmer so that we can do a newborn assessment and we can do medications. Under here, you'll also notice that right at delivery, there will be some more equipment in here. We like to be prepared. We like to be ready in case a baby needs any kind of assistance. Then we can just move baby over and start working on them. You'll notice that we have oxygen hookup here. We have suction. And we have also emergency medications and everything right here to take care of a baby if that were needed. We have wonderful neonatal intensive care unit services as well. If we needed that, then one of our nurse practitioners from the NICU would come down and assist us. Otherwise, we're going to do the assessment under the warmer. This is going to be a lamp that is helping heat the baby while we're doing the assessment, as they do have to be naked under here when we do that. So this probe, I get this question a lot. What is this exactly? It goes right on the skin and it helps the machine monitor and adjust the temperature. Under the warmer, we are going to go over all bodily systems. There's a checklist that we use, and your nurse is going to make sure all bodily systems look normal initially, and we're going to take our time with that. It does take about 30 minutes under the warmer to go over all of the assessment pieces. We're going to do measurements of the head, the chest, and the length. We will also weigh the baby here, and we also give medications at the warmer. The 3 medicines that we give are an eye ointment, erythromycin. It's an eye ointment that simply goes right there in the eye. It'll wear off in about an hour. We give vitamin K, which is an injection in the thigh. It helps babies clot their blood. And then we have the optional vaccination that's offered to you. You would sign a consent for it, but the hepatitis B vaccination, that's given in the opposite thigh as an injection. Those are the 3 medicines. Once baby is done with the assessment, we go ahead and we offer the bath. We'll do a sponge bath, and then we will wash their hair, and then they'll need to heat up before we move them out into the open crib. Once we have baby heated after the bath, then their diapers placed on them. They have a t-shirt on and a hat and blankets. I encourage you to keep the hat on the baby's head as they lose heat out of the top of their head, and we want to make sure that their body temperature stays warm. So that's just an important piece. I know everybody wants to look at the hair, but if you would, keep the hat on them, and that'll help their temperature regulate a little bit better. And then this just simply goes back into the cabinetry. And then we will move over to the open crib here in just a minute. Okay, so right over here. The open cribs are, baby is identified with some identification pieces here on the crib to make sure baby goes into the right room. So we do have a few extra things when we actually have a baby in these cribs. We supply everything you would need. So extra t-shirts, extra blankets, diapers, if you were to need formula. I do get questions quite often, do I need bottles? Do I need my breast pump? And the answer is no. We supply the formula and the nipples to the bottles that you would need, and then we also supply a breast pump here at the hospital. And feel free to ask for extra. We try to stock it really well, but these are great. They're very sturdy. I'm also going to encourage you to keep baby in the open crib. Moms usually will have sometimes some pain medication on board in their systems, and we don't want you to walk around holding your baby. If that's the case, we want baby in their own safe sleep space, and also not to have your baby sleep in the bed with you. We want them in their crib. If you want to walk out into the hall, we also want you to put baby in the crib and push the baby in the hallway, not to carry the baby. Okay, we're going to move on over here. Just some small items but it's great to know that we have a refrigerator in every room. I encourage you to use that. Drinks, food. Sometimes labor can move very quickly. I like to tell moms and support people to have snacks in their labor bag. And then you may also want to have a cold sandwich or something in here that you can eat just for that reason of the labor moving a little quicker than you would anticipate. We have in here the labor cart. And when we're getting close to delivery, we're gonna get this out and set it up for the provider. Has everything in here that they would need for the delivery. We'll get everything out. We'll drape this with a blue cloth. It is sterile. They'll want you not to touch what's on here, but when we're done with it, we simply stock it and then we'll put it back in the cabinetry here. Every labor room also has a closet space. If you can get, I don't want to get in the way too badly there, but it is a space for our moms, for your luggage, anything at all you can put in there and store within that cabinet. Our lighting is wonderful now. We don't have the ceiling full of fluorescent lights. We do offer, and we have the state-of-the-art lighting system. Really helps to focus the light on where we need it to be, and it keeps the bright lights out of mom's eyes and helps her also. Lighting can also be very helpful when coping with labor pain. We have TVs in every room. They have a DVD player on the side, normal cable, and it'll really help pass the time if you need to. We have boards that will give all of your nursing information. Our nurses carry SpectraLink phones. If you were to pick up the phone, telephone here over on the cabinet and dial the nurse's 4-digit number, you'll get your nurse. It's a great way to contact her if you need anything. You'll have your labor nurse, and then postpartum, you'll actually have a postpartum nurse and a baby nurse. Let me talk to you a little bit about your stay here at the hospital. Vaginal deliveries can go home 24 hours from the time of birth, and C-sections can go home 48 hours from the time of birth. Keep in mind, there can always be an adjustment in your stay. We may need to lengthen it a bit, depending on what goes on in labor, or so on and so forth. And then also, we don't want to discharge you late at night, so we may wait to the following morning to do your discharge. Very important pieces here. This is the hand sanitizer. We also have a sink and a sink in the bathroom. We want everyone to wash their hands when they come in to visit mom and baby. And if you have any family members or friends that are experiencing any kind of illness, to encourage them to please wait until they're feeling better to come visit you, and that you'll be home shortly and they can visit with you then. Okay. I think now we're going to go ahead and move down the hallway to the Well Baby Nursery. So just follow me. Okay, here we are at the Well Baby Nursery. You don't see any babies this afternoon. They are all in the rooms with their moms. We encourage boarding in, rooming in. That way bonding starts happening. You are getting used to and acclimated to taking care of your baby, and you'll feel more confident and comfortable doing that when you get home. But we do have our Well Baby Nursery. A few things do happen in here. We have, for one thing, we do hearing screens here in the nursery. We find it's very important to go ahead and screen newborns for any kind of hearing loss, so the babies will be brought in. We do that while they're sleeping, and it's non-invasive. But we hook them up and we can go ahead and look at their brain waves in relation to sound and know how well they're hearing even at that early age. And your nurse will go over the results of the test with you, okay? We also do discharge teaching classes in the Well Baby Nursery. We encourage everyone to come, mom, support person, and baby to come in, Your nurse goes over very helpful information about your care postpartum, and then also newborn care. Again, all helping you feel more confident and comfortable when you go home. Your nurse will let you know when those classes are happening during the week and the weekends. Our pediatricians come to the Well Baby Nursery to do some of their assessments. I'd like to go ahead and tell you our pediatrician groups that come here to the hospital: Catawba Pediatrics, the Child Health Center, and Unifor Pediatrics. We do have a Catawba Valley Family Health Systems Network as well, where some of our family doctors may come and see babies as well. You do want to go ahead and pick out your doctor for your baby. When you come into the hospital in labor, we will ask you who your baby's doctor is going to be. We will also do any kind of extra tests, lab work, x-rays. We really try not to take our babies out into the hospital, so most of our services will come and meet us here at the Well Baby Nursery. Security is very important to us here at the hospital. Our nursery door is locked. We also have a locked unit, and as we go back into the unit, you'll notice I'll have to scan my badge to go back in, so that unit is locked itself. We also have security measures on our babies, one of which is identifying bracelets. Right after delivery, we will put identifying bracelets, 2 on your baby, 1 on mom, and 1 on support person. All the bracelets have identifying information on them along with a number, and they all correspond. If your baby ever leaves your room and comes back to your room, we're going to check the numbers of a parent bracelet against a baby bracelet to make sure baby is in with the right parents. We also put an alarm bracelet on the baby's ankle. What that does is it helps us to make sure no one is trying to take the baby off the unit. It's kind of like an electric fence kind of thing, where baby cannot leave the secured area. The alarm would go off, and then no one would be able to take the bracelet off. The alarm would sound if anyone were to try to take the bracelet off. When you are discharged, we will then remove an identifying bracelet, double check that again with a parent bracelet, and we'll also take off the alarm bracelet at that time. We also do, I think we went over any extra services. Circumcisions are also something that we will do. Of course, not right here, but we have a smaller room for circumcisions. We will perform those here at the hospital. If you choose to do that, it is best that we do it here at the hospital. Your nurse will go over a little bit more in detail about the care of the circumcision, but your pediatrician will come to the room, go over the procedure. You'll sign the consent. We'll bring the baby here. They'll have their circumcision, and then they'll come back out to the room to you. You'll also notice on this side of the unit, we have some overflow rooms. Sometimes we are at full capacity or close to it in the birthing center. So we have overflow rooms. Our moms who have already delivered, who are in postpartum care, may come down here and finish out their hospital stay in one of our overflow rooms. They're very nice. They're still very spacious and newly renovated as well. You'll find that those are down here on this hallway, and we would let you know if we would need to move you down here during your stay. Okay, I think we are ready to move on back into the birthing center. So here we are at our operating room suite where we perform our C-sections. They are performed here on the second floor. We can't actually go in the operating room suite. We would have to have on all of our gear to do that, but I wanted to show you the area and talk with you a little bit about the C-section process. If you're having a C-section, you may have one support person in the operating room with you. We will also use either an epidural or a spinal for anesthesia so that you can be awake during your surgery. We really want moms to still have a full birth experience. Another piece of equipment that we offer in the operating room is a full video monitor. We can turn that on and you can see more of that birth process if you would like to. At the birth of the baby, we will show you your baby, and then the baby will go over to the warmer and have a full assessment with one of our nurse practitioners. They will go over their own assessment. Most of the time, our babies just need to be removed from that labor process and they will do just fine. So as the baby is perking up, doing well, we'll call support person over to the warmer, and at the right time, we'll let support person take baby over to mom. Mom, you'll be able to do skin to skin, or the support person could do skin to skin, but we just want everyone together even while we're finishing up the surgery. After the surgery is completed, so the repairs to the abdomen have been made, then we'll want everyone to move over to a recovery room. Once we're over there, we will start with the feeding, breastfeeding or bottle feeding, and then it'll follow very similar progression to a vaginal delivery. We'll do the assessment in a warmer in the recovery room, going through all those checkoffs that I already told you about in the birth room. And then once we're done in the recovery room, then we will move out from recovery back to a labor room. Again, just to review, your labor stay for a C-section is about 48 hours from the time of birth. And also, if your baby needs any of our NICU services, that stands for the Neonatal Intensive Care Unit, that is on the 3rd floor. We have wonderful staff up there that will go over the process, and as soon as we have mom settled, then we try also to get mom up to the Neonatal Intensive Care Unit to be with her baby as soon as possible. We thank you for choosing Catawba Valley Medical Center for your birth, and thank you so much for joining me on the virtual birthing center tour this afternoon.